Go to www.agelesshealth2012.com for your special invitation.
Do you suffer from the debilitating symptoms of chronic pain, swelling, and loss of joint motion due to arthritis? Are you taking drugs like Celebrex and Vioxx or other super aspirin prescriptions? If you are, you're increasing the risk of heart attack and stroke by up to 50%. This is Dr. Tom Roselle, host of Dr. Tom Roselle Live Sundays at 12 noon. Why live with pain or the dangerous side effects of drugs when the doctors at the Roselle Center for Healing, practicing 21st century integrative medicine, can help you experience relief like never before? Simple, safe, chiropractic, acupuncture, and nutritional care can provide significant relief from arthritic pain in less than 6 weeks. More than 70% of our patients experience a return to life far beyond their expectations. Give yourself the best gift possible, freedom from arthritic pain, naturally. Call today to schedule an appointment. Call 703-698-7117 or visit online at rosellecare.com.
Dr. Tom Roselle Live right now on 105.9 FM and AM 630 WMAL.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. I'm live in studio waiting for your phone calls. 888-630-9625. That's 888-630-WMAL. Love to talk to you. We're broadcasting from 105.9 FM and AM 630 WMAL. Love to talk to you on any subject that you have in mind. Perhaps you've had a problem, you've tried, you've applied. Well, this is an opportunity to really put the fire out and do something without drugs, without surgery. You know, all those things you've been taking for such a long period of time. Well, I'm here for that very, very reason, is to show you that there are other ways, there's other things that you can do that make much more sense than the things that perhaps you've been trying. So 888-630-9625, let's talk to you. I have a very special guest in studio today, someone who is very knowledgeable in an area that is extremely controversial, and one that we utilize relative to recommendations, and a diagnostic tool that is invaluable relative to so many different things. We've talked to you about digital infrared thermographic imaging over the years, and in studio we have a very special person, Tammy Leiner, who is a registered certified medical thermographer as well as a principal in thermography centers. That is one of our very special sponsors of Dr. Tom Roselle Live. Tammy, welcome.
Thank you. Good morning.
Good. Well, actually, it's afternoon. I'm usually confused too, so I'm glad somebody else makes the same error that I do. I walk in here and it's that bewitching half of the part of the day where it flips over to the other side, and I'm saying, oh yeah, it is still the afternoon. Anyway, thank you for being here.
Thank you for having me.
This Wednesday evening, Tammy is going to be our in-house presenter at the Roselle Center for Healing in Fairfax, and she's going to be talking about all those things you ever wanted to know about thermographic imaging, the whys, and are you a candidate, something that you should consider. And as far as I'm concerned, ladies, every one of you should be a candidate, and it should be part of all of our annual diagnostic elements. We're going to talk about that a little bit more, and what she's going to get into. But today, and for the meat of the program, I'd like to talk about thermography and infrared thermography. Basically, from a standpoint of view, let's start with Tammy. Tell us about thermography. I mean, thermographic imaging, we know, is something that identifies heat signals.
Correct.
But we're going to talk about it relative to medical application.
Okay.
So take us down that trail a little bit.
Well, let's start off and state that thermography is a diagnostic tool that's used to visualize heat in the body, inflammatory processes, circulatory processes, things like asymmetric patterns, which show different sorts of probabilities, or just the informational package for the individual themselves and for the practitioners that are treating them. So starting off, what the camera does is it takes a picture of a specific area of region of the body, and then we have medical doctors that do the assessment to tell the client and the physician what could be going on, might be going on, and the heat and risk factors of the specific location.
Now, thermographic imaging has been around forever. I mean, we can go back to actually World War II or before that.
Right.
And it was used in those days for military and industrial uses to find cracks and signals relative to radiation exposure, nuclear, and so forth. And then it became, hey, this is a great idea. I wonder if it can pick up, and the medical arena began to unfold.
Right.
And there are a lot of people who should consider this, and we're going to get into what that's all about. But basically, it picks up a heat signal, and in the body, and it doesn't diagnose masses, it doesn't diagnose fractures, it doesn't diagnose anything, but it takes and interprets a heat signal. What does that mean? Why is that important?
Well, a lot of the inflammatory processes that happen in the body are, conducive with, disease, arthritis, pain patterns, specifically with acidic situations, like when the body is not alkaline, and it can show or give the information process an idea if the body is, in its homeostasis versus in an inflamed sort of a situation. So by visualizing what's actually going on in the body energetically as well as inflammatory, you can, better take care of self.
So Tammy, let's talk about something as simple and unfortunately all too often every day, a vascular problem.
Okay.
Now we have these lifeline things that are out there, and they want you to go for ultrasound. They want you to do for all those things. Mm-hmm. So we'll talk about the arteries of the neck, the carotid arteries. They go from the big branch coming off the heart called the aorta, and then they divide into these carotid arteries, and the carotid arteries go to the brain. And they're of particular interest simply because they plaque. And in too many people, some people, they stay nice and patent and soft and open and the blood flows good. But in some people, they plaque up and we have issues with them. So here's an area. So in thermographic imaging, there's a distinguishing feature between a good, healthy artery of the neck, the carotid arteries, and one that's not so healthy. Mm-hmm. How does that show up?
Visually, it shows up in the color range of, specifically in the orange, red, or white color range. In the thermographic color range, it basically, the harder the blood flow is going through the carotid artery, the more it shows up as a heat pattern. So it is a precursor to, heart disease and stroke risk. And when we visualize this, the heat patterns are very, very simply, visualized from the scan itself. Add on, stress factors and, risk of heart disease, family history, and looking at potential heart risk factors, you're more likely to have a stroke or a heart attack than many other things that are going on.
Well, inflammatory pathways are a result of acid, and acid is heat in the body, and that's why the body plaques. It doesn't plaque because there's too much fat. It plaques because there's too much acid, i.e. inflammatory processes. And so you have a situation here where you've got a neck, let's say, these arteries that light up, they're hot, they visualize in red. I've seen many of them. Mm-hmm. And, when they get really bad, you see these white shadows in between them. It's like there's a real bad situation there.
Right.
However, let's distinguish that relative to a ultrasound. And obviously they do two different things, but accuracy-wise, is one more accurate than the other?
They are about the same efficacy between ultrasound, and the only difference being is that the heat patterns are visualized earlier than a problem generally happens.
So in other words, the intimal plaquing, and when I say intimal, I mean the artery has a layer called the intima, and so that area is going to start showing a heat signal, an inflammatory picture, if you will, before you can pick it up diagnostically on ultrasound.
Right. With the plaquing, what happens is that the blood is having a harder time getting through the artery itself. And so the struggle to get the blood to the brain is the visual that we are seeing.
Okay, so when the artery starts getting actually tough and it starts hardening before you even start seeing the heavy plaquing,
Right.
that is going to narrow and occlude the pathway.
Exactly.
888-630-9625, 888-630-WMAL. That's where we're at, and how you find us off the air is go to rosellecare.com. That's ROSELLECARE.com. And either way, we're delighted to answer your questions. Before we go much further, I'd like to go to the phones. We have somebody waiting patiently. Mike, how can I help you, sir?
Hey, thank you, doctor. I have a question. I'm sorry that it is only tangentially related
Well,
to your...
I'll make it related.
Okay. But I need your opinion about a product. It's a dietary supplement called a nanoblock.
Spell it for me.
A-N-A something D-L-O-C.
It's a manufacturer's, obviously. I think I know what you're talking about. Antablock?
I think that's it.
Okay, it's an anti-inflammatory. I think it's one that you find at GNC. When I was wandering around the mall, I think I saw it.
Yes.
Okay, so that's a manufacturer's label. It doesn't tell us necessarily what's in it. So
right.
Any type of anti-inflammatory is a good thing, but you have to look for several things. One, you want to make sure that they're clean products, they're organic. The product, and I pulled it up, by the way, because I don't know the product well enough, but it's talking about, it has a composition of fish oils and DHA and so forth.
And some tobacco stuff in there, too.
Yeah, that's what I'm saying. So on the surface, the product has a lot of different things that are involved in it. The DHA and the fish oils and so forth are not a bad thing at all, and they can help all of us. Now, the only thing that I'm going to tell you about that is you have to make sure that it's a good, reputable company, that there are trials on it, that they have that they meet certain nutritional standards, that the products are as organic as you can possibly get, because if they're not, you can end up causing what you're trying to get rid of. You can end up causing a inflammatory process. Now, any kind of joint space degeneration, arterial problems like we're talking about now, all of those things respond very, very well to something like Antablock, and in this, what they're touting to be a natural anti-inflammatory. The studies apparently are limited. They're not significant. It came off a program that apparently was a multi-level marketing thing, and then GNC went in and picked it up. So I would be very, very careful. And using this products that we use, I rarely will refer anybody out to do a multi substance product, simply because of the fact there are too many variables and people check differently for each one of these things. For example, in our office we have 5 different products that we use for omega-3s. We have several other products that we use just for specifically DHA. We have products that we use for the ACEs, vitamin A, C, and selenium. Those are important in the body, and you have to have them at certain levels. But you can't take things just arbitrarily. When you have inflammatory pathways that are stimulated, the question why they're there to begin with is usually the one that's not asked, and
I've got spinal stenosis.
Okay, spinal stenosis is a end product of itself. It is not a why it happened. Usually, spinal stenosis comes as a result of structural damage over a period of time, and that structural damage is enhanced, causing degeneration because of the presence of acid in the body. Acidity promotes inflammation. So, using my mantra, sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, you can do a quick check in the body. And then the next question you ask is, are you eating enough vegetables, meaning 7 servings a day? Serving is a half of a cup. Are you drinking enough water to flush the system out? Are you drinking things that are inflammatory, as we just talked about? you have to go to the why. Is there structural pain that has never been taken care of? Are there allergy responses to other foods that are in the body that haven't been dealt with? All of those things have to be dealt with first. Otherwise, you're using nutritional supplements as you would a drug, and that doesn't work either. Mike, do me a favor. Send me a note on rosellecare.com, and I will give you some more data, and I'll give you some more specific information. I'm going to encourage you to shy away from this product. Mike, thank you for calling. I appreciate it. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. I'm here at 105.9 FM and AM 630 WMAL. Love to take your phone calls. 888-630-9625. That's 888-630-WMAL. Let's talk about it. We're talking about infrared thermographic imaging. My guest in studio, Tammy Leiner, and she's going to be your host this coming Wednesday evening, the 3rd of the month, this brand new month of October, and she's going to be talking about diagnostic thermographic imaging. Ladies, for you, for breast thermography, the importance of it, the differentiations, the accuracy of it, why each one of you should be doing it. It can detect all kinds of vascular problems. It can give you autoimmune reactions. And by the way, Tammy's company, thermographycenters.com. Take a look at it. Go online. Go www.thermographycenters.com. You're going to find the different locations, and there's many of them around the Beltway. How many, Tammy?
40.
40. You're growing like crazy. This has got to be one of the fastest growing companies I've ever seen.
Well, it actually gives a lot of kudos to the practitioners that are, referring out for this, as they know that mammograms are not the only game in town.
Mammography has been cited as the diagnostic piece for breast cancer and to rule in or out breast cancer. And I've had my issues with it over the years because I know the literature, and the literature says very simply that if you have 4 to 5 breast images, that you increase your risk of breast cancer up to 40%. That number's huge.
Yep, 2 to 5%.
So it says, here's the deal. How do we do something diagnostically to find out whether a woman is susceptible? And the answer is thermographic imaging.
Right.
So let's talk about it. Why thermographic imaging in breast cancer? Why should every woman, from the time she's young to the time she's no longer with us, have a thermographic baseline to be able to go on an annual basis to do comparative?
Well, there's many reasons. Let's start off with the obvious, meaning that women at any age can utilize thermographic imaging, as it is a non-invasive, no radiation, no compression, no squeezing type of diagnostic that visualizes activity instead of visualizing mass.
So it protects all that soft, tender tissue.
Correct. Yes. Activity is visualized on a thermogram many years before mass is even seen. So basically, after a cancer is in your body, 6 to 7 years, the mass actually is visualized.
So before the mass shows up, it's even palpatory, can be imaged on MRI or anything else. The thermograph can pick it up.
It looks at the blood supply. Now, cancers and tumors all require a blood supply, so a feed to a specific area. Over time, this blood supply becomes hotter and more significant and larger in size, and visually on a scan, you can see the activity level, which is the heat level that it's generating, where fibroids and cysts do not require a blood supply. So it's a little different visual of that.
So let me ask you a question that a lot of physicians are throwing out there who are not on board. Accuracy rate. How accurate are we talking about relative to it actually showing false positives, false negatives? What's the data there?
The efficacy that's out there is basically it has about the same efficacy as a mammogram, as there's nothing out there that's absolute or perfect, as we all know, or they wouldn't be, 5 to 10 different diagnostics for visualizing, an issue in the breast. But when utilized with, different types of diagnostics, meaning physicians checking you and maybe thermographics, ultrasounds, this halo breast pap that's kind of new in the area that I'm excited about. There's different ways to do it, and we're not the type of place that looks visually, we're looking to keep you well. If we see some images, we can try and educate the participants on how to reduce their risk factors versus we want to find it. We don't want to find it. We want to keep you from getting it.
So when you're dealing with breast imaging, and that's what we're talking about right now, is a woman comes in, and my understanding, she has to have an original and then a baseline, or that second that forms the baseline. So 2 images within 3 months, right?
Correct.
Okay, and that gives you a baseline, and from that baseline, diagnostics are made on an annual basis, and it gives you the opportunity to see any changes, and as you said, anywhere from, and I think the numbers are up to 8 years prior to the formation of the mass itself, that you begin to see the heat signal.
Right.
So you can see the changes.
I have, yes, and I have at the lecture, for participants of the lecture, I have studies that are over 20 years for women who have, been diagnosed with breast cancer and who have not been diagnosed with breast cancer.
This Wednesday evening, the 3rd, Tammy Leiner at the Roselle Center for Healing. Give her office a call, 703-698-7117, 703-698-7117. Welcome back. This is Dr. Tom Roselle. You're listening to Dr. Tom Roselle live. I'm at 888-630-9625. That's 888-630-WMAL. One of those mornings or afternoons, as you may think, that my brain is not firing on all pistons, but I keep trying harder all the time. My guest in studio, Tammy Leiner, who is a medical thermographer and a principal in the thermographycenters.com. So go online, and I said .com, so you can go check it out. She has over 40 centers throughout the Washington metropolitan area. Diagnostic imaging, infrared digital thermographic imaging, is one of those amazing tools that we use extensively in our practice to look at any kind of inflammatory vascular event and the early detection of many cancers, simply because of the fact that a cancer that has a mass, a tumor, or any tumor has to have a blood supply. And if you can identify the blood supply, you can identify the process early enough that you can do a whole lot of things to turn it around before it gets a hold of you. Isn't that an amazing situation? Don't think that's kind of just, oh, well, I'll wait till it shows up type of thing. It's about prevention. And as time goes on, you are going to be the captain of your own ship. You are going to be the one that's going to make the decisions. And the more tools that you have, is something as simple as this, non-invasive, without any side effects, you have to make that part of your annual, every year diagnostic. Give our office a call, 703-698-7117, 703-698-7117. Tell my staff that you'd like to attend. This Wednesday's the 3rd of October. That's right, it is October now. October the 3rd. Tomorrow. It is. It's scary. It's going by so fast. I have no clue what time or date or anything. I mean, this next 6 weeks for me is going to just blow by so quickly, and hopefully Christmas will come and I can put my feet up for a few days. But anyway, before we do that, we have a great seminar this Wednesday evening, 703-698-7117. I'd like to go to the phones. DC, you've been holding very patiently. How can I help you, sir?
Hey, good morning. Good afternoon.
Good afternoon.
At this time of the year, anytime it gets a little chilly like this, I get this numbness in my extremities. When I say my extremities, it's the tips of my fingers and the tips of my toes. It's not so much in the summertime, unless there's some heavily air-conditioned rooms or something like that. But even as I'm speaking with you now, it's the tips of my toes are numb, and the tips of my index fingers on my left side more than my right. And
it starts when the weather changes?
Yes.
Okay, it can be several things, and one of the things that you rule out first is Raynaud's phenomena, where you have a vascular constriction of the distal circulatory pathways, and it can happen as you're explaining, but it also happens in other things, like if you're a cigarette smoker or exposed to smoke, different types of fumes. Now, what we also see structurally is if there's been any injury to the spinal system, particularly the neck or the lower back, or just the upper portion of the neck, and it can affect the entire spine, the nerves from the spine go to the blood vessels, and so subsequently the nerves aren't firing as well as they should, and then when it gets colder, the tendency is the whole body is going to tighten up and constrict, but it's primarily the blood supply. So it can be that. Things that you can try relative to biochemistry, change your diet, obviously. That's the first thing I'm going to tell anybody, is you want to shift the body as far alkaline as you possibly can, eliminating all the junk we talk about, the sugar, sodas, coffee, teas, fast food, fried foods, alcohol, gluten, additives, preservatives, and eat as many...
I'm drinking my Dunkin' Donuts coffee.
There you go. See, we already have part of the problem solved. No, seriously, all kidding aside, that can cause vascular constriction significantly enough that can irritate some underlying problems. Add a good quality fish oil. Do not get it from, the drugstores. Go to the health food stores. Go to Mom's. Go to Fresh Whole Foods. Go to the apothecary at Wegmans, Kennedy's, and so forth. They've got some great products. Ask them for the best. Take somewhere in the neighborhood of 1,200 to 1,800 units a day. Now, if you're on any kind of vasodilator, or if you're on any kind of blood thinner, if you're on any kind of aspirin type of product, you really need to have somebody direct you on this, because it'll cause your blood to thin even more. Our patients, I try to get them off of the medication and onto things like this. Vitamin E, the succinate form of vitamin E, also helps significantly. Either niacin, low dosages of niacin, or ginkgo. Ginkgo is a vasodilator. Those things will help open up the blood and the circulatory pathways. But if you know that your diet is not as supportive as it should be, if you know that you've had injury to your spine, those are the things that you look at first. Acupuncture can be extremely, extremely effective in reversing some of these things. Tammy, with this type of situation where he's getting vasoconstriction, thermographic imaging is going to show where it starts and the whole path that's involved. Is that correct?
Yes, specifically if it's an injury sort of a situation, visualizing the spine, we're going to kind of pinpoint what specific area is actually is affected. So it can show on a thermographic image the circulatory process, meaning if there's no circulation to one or both, hands, feet, or whatever region that is the problem, it's going to show, that sort of a situation.
Does this make a little sense to you, DC?
Yeah.
If I can be of further help, please call and join us this Wednesday evening if you'd like. Give our office a call, 703-698-7117, and just tell our staff that you'd like to attend. It will be very, very revealing. It's going to be a whole wide, eye-opening experience for many of you. When you see some of these images that Tammy's going to put up, the process always surprised me. Sometimes it's... the thermogram is something that makes me decide between X and Y, and it's always accurate. We know that about, when you go into physician with a breast problem and you have a lump and your physician wants to biopsy the lump, 20% of the biopsies are actually cancerous. So you got 80% of them that are not cancerous tumors. So here we have someone who's scared to death. Doctor says, you got to go in for a biopsy because I see something on the MRI. Is this a place where thermography can divine it, can say, your chances of really having a problem here are very, very minor compared to what your doctor may think?
Exactly. It's just like you said, it's another tool in the toolbox. It's a visual to see if there's any activity level, in the specific area that is being, visualized.
Tammy, you have a whole group of physicians, MDs, that's all they do is they just read these films all the time.
Yep, there's about 12 of them. They are located all over the country, and some are radiologists, some are emergency room physicians, some are breast specialists. They kind of range from a lot of different, but all medical doctors. And they do this as an interpretory in the interpretation part as a living. I mean, they do a lot of screenings.
So, thermographic imaging, and I'm going to ask you, I'm playing devil's advocate. Obviously, I'm very, very, very aware of thermography. We use it in our office. We have one of your sites in our office. And it's an invaluable tool to us, but I'm going to play the devil's advocate with you, and I'm going to be the doc out there who says, this is nothing but bunk, it's garbage, and you have to go traditional measures. You have to do the MRI first, then maybe an ultrasound, then maybe an MRI. So if we have a tool like this that is so good, they're calling it spurious.
Right.
Okay.
Right.
It is, it doesn't work. It doesn't show anything. Why the controversy, Tammy?
Oh, there's so much. I hope I can remember a tenth of what I talk about. In the beginning, it certainly is going to give you just more information. For physicians who want to debunk it, I guess the first question I would ask is, what do I it's not hurting the patient. It's visualizing, giving the patient and the physician more information. What do I say to the women whose mammograms were missed by the traditional mammograms? The masses were missed. Visualization, there's just more information out there. And for young women who have very dense breasts and masses are very hard to visualize, the visual vascular activity is not hard to visualize in a thermogram.
How early would a young woman want to incorporate this into her annual examinations?
If she has a strong family history, meaning mother, grandmother, sister, strong family history. I have girls that start at age 18 who are just, have a lot of breast lumps and are concerned that each lump that they get, it's more of a dietary, sort of issue when you're at that age. But yes, there are women out there that are diagnosed with breast cancer age 20s, age 30s. You can get started at any time. That's the beauty of thermography, because it's not going to affect the body at all.
This Wednesday evening, the 3rd of October, at the Roselle Center for Healing in Fairfax, Tammy Leiner will be your host, your presenter, and she's going to be talking about thermography and its applications, its medical applications. If you have any kind of potential vascular problem that you're playing with, if you have a question relative to what if I use this and should it be incorporated, this is the lady that can answer the question. She's going to show you some very interesting things. She's going to give you a checklist of those of you who are the most susceptible to all types of different types of problems. I would encourage you to be there, because you're going to learn a lot. It's going to diffuse some of the myths that may be out there. And trust me, the science is there. It's been around forever. Medical diagnostic imaging has been around in this country and Asia for over 20 years.
Yep, almost 30.
And, it's the information, the studies are significant. And some of you are going to ask, well, why doesn't traditional medicine accept it? Well, they do. Many of them do. I can name you dozens of physicians, and Tammy has them in her 40 different sites around the metropolitan area. But the bottom line is that it is a tool that you can afford not to have as part of your armamentarium, and I would encourage you to be there. 703-698-7117. I also want to encourage you, October the 20th, it's coming up very, very quickly. We have about 5 weeks left, I think maybe less, 4 weeks from this Saturday, 3. She's putting up 3 fingers, 3 weeks. Ageless Health 2012, How to Live Well in a Stressful World. We have a few more seats remaining. We'd love to have you as our guest. Our presenter, our guest from out of town, the prophet is coming, Dr. Evan Mladenoff from Kansas City. He's going to be talking about the emotional side of healing. Evan is a great guy. He's one of my best friends in the profession, one of the most amazing and delightful people to listen to as a presenter. He's written the book, Stressed Out, Headed for Burnout. It's been all over the world and back again, and this is an opportunity for you to meet a real amazing professional. He was a doctor at the Kansas City Chiefs for 12 years. Be there. And to register and to save some money, go online. Go to rosellecare.com, ROSELLECARE.com. And if 2 of you register, you'll receive a discount. If you register online, you're going to receive a discount. So do that today, because I'm afraid we're coming pretty close to having a full house, and that is that. We were excited to hear that there's a whole bunch of students that called us and said that they'd like to come, and we had to say, listen, we can take a few of you, but we're not going to take all of you because we just don't have the room. But don't put it off anymore. Go online, rosellecare.com. And by the way, that's how you find me off the air, and to ask any questions that you like to. Right here, it's 888-630-WMAL. Tammy, let's talk about a little bit more of the differentiations of what we need to know about thermographic imaging, such as when somebody's a doctor, for example, needs to consider a differential diagnosis. Patient's not doing well. Patient is suffering from a respiratory problem. They're congested. They have, it's suspected to be allergen. Can this distinguish between systems and, give credence that it's more allergic than viral than bacterial?
Yeah, we did a seminar in Orlando a couple weeks ago on allergy testing, and it's a very safe visualization of the activity level when placed on the body. It's a easy, non-invasive way to visualize this minimal or not so minimal activity, and can give you as much information as needed to, pursue other things.
Thermographic imaging has been very significant in our practice, and we use it extensively as an additional tool based on need, whether it's an allergy patient, whether we have a lymphatic problem where the lymph system is congested. A patient comes in and both ankles are swollen, from the knee down. Thermographic imaging can actually show if there's any blockage, and from the place where the heat is, and then the heat stops. Is that correct?
Correct.
So when you have that lymphatic pooling, and it can be cardiovascular as well, what we've used it for in the past is where we'll have a patient have the swollen area imaged, and then we have their heart imaged, and then we have the upper drainage area of the lymphatic system imaged, and we can tell where it starts and where it ends. It's a neat tool, and it's one that's not invasive, and that's the thing that you have to remember. There is virtually no side effects. There's none that I know of.
Right.
Are there any?
No, nothing. It's basically taking a picture of the temperature that you're radiating off of yourself. And so there's nothing that's going into the body whatsoever. And if I can bring up a little thing about the lymph, if you don't mind, on the lymphatic system, 80% of all breast cancers happen in the upper outer quadrant in the armpit area of the body, where the lymphatics are housed.
Welcome back. This is Dr. Tom Roselle. You've been listening to Dr. Tom Roselle live, broadcasting you from 105.9 FM right here at WMAL. Every Sunday at 12 noon, bringing you the most up-to-date information that we possibly can, just like today on thermographic imaging. Want you to know more and more about that. Thermography Centers has been a sponsor of Dr. Tom Roselle Live for a long time now, and so we finally got Tammy Leiner to come in and give you the skinny, as they say, on thermographic imaging, and she's going to be your host, your presenter, this Wednesday evening, the 3rd of October at the Roselle Center for Healing. 7:30 is the time, and all we need to do is have you call our office at 703-698-7117, 703-698-7117, and as you might expect, this will be a very well-attended presentation, so don't tarry. Call today. Pick up the phone, 703-698-7117. Tell my staff that you'd like to attend. If you call today, obviously you're going to get a recorder, and they will call you back bright and early tomorrow morning to confirm your seat. So make sure that you get on the phone and do it right now, 703-698-7117. And don't forget, Ageless Health, October the 20th. Go online, rosellecare.com. And by the way, don't forget to follow us on Facebook, because I blog there all the time. Have a new website that's going to be coming up soon, and we'll tell you more about that as time goes on. Tammy, you're going to present an amazingly interesting subject this Wednesday evening, one that I am looking forward to hearing you present, and images on cancer tissues and the progression from a normal scan to one that's enhancing over time. So other than that, tell us what you're going to do and the types of questions that you can feel and why people should attend.
Lots of reasons to attend. Initially, to start off with, is that I'm going in my 9th year of doing this type of screening diagnostic, and I have learned so much over the time frame that I've been doing it. I have so many wonderful things to share, things that you can do for preventative situations, preventatively, to keep you from getting it. We have some information to share with you there. Who's at risk? There's lots of different people who are at risk for different reasons, and this list is going to be, some information for you to see if you are at risk. If you're doing mammograms on a regular basis, is this something you can add on to, or would you use it in replacement? There's different answers for different people. So I have just a plethora of information to give.
I'm looking forward to it. It's going to be a fun night, and we encourage all of you to pick up the phone and call. There's so much that can be learned from a thermogram, particularly in relationship to other types of examination procedures as well. If you show a high level of inflammatory evidence based on blood work, and now your thermogram of your neck or your breast tissue or of your legs, of your body, tells you, we got a problem here. Now they correlate. Now you know you got to do something. If you don't show an inflammatory process in your blood work, but it shows up on thermogram in a specific area, it tells you a different story. So the correlation between them is something that I wouldn't do without. So we would encourage you, give us a call, 703-698-7117. Tell my staff that, you need to be there, and we would love to have you. You're our guest, as always. All of our in-house programs are absolutely no charge to you. Now, coming up soon, we're going to have some real exciting information. There's a website that we're creating, and hopefully within the next week or two, I will have that data for you, that a lot of our presentations will be put in a webinar format, and you'll be able to go there and download them. You're going to have to pay for them, unfortunately. Where you become in-house, they're free. But so many of you are way out of the area and you can't get to our practice. So we're doing this for you. Tammy, thank you. I appreciate it.
Thank you.
And obviously I see you on a very regular basis, but we'll see you this Wednesday evening. We're here every Sunday. And any questions that you may have, this is your opportunity. You're going to call here at WMAL and let us know what it is that you'd like to know more about. This is Dr. Tom Roselle. I'll see you next week. Bye. Are you looking for great tennis instruction in a dynamic, challenging, and fun environment? Hi, this is Dr. Tom Roselle, inviting you to visit rjtennis.com to learn about the most popular adult tennis program in the metro area. RJ Tennis programs are packed full of energy and non-stop tennis. With exhilarating drills and games, RJ Tennis will energize your game, fitness, and life. So call a friend and sign up today at rjtennis.com. That's rjtennis.com.
Did you know that breast cancer is on the rise and that routine annual mammograms can increase radiation exposure to breast tissue 1,000 times over a chest X-ray? The result could increase the risk of developing breast cancer. Now, consider a simple, non-invasive, and totally safe adjunct medical procedure approved by the FDA, which can detect evidence of breast cancer 5 to 8 years before it can be visualized on a mammogram. Infrared thermographic imaging can accurately detect initial signs of breast cancer, such as increased blood supply and metabolic rate, which is recorded as heat. Why expose yourself to radiation when accurate and safe medical detection is available? Call Thermography Centers at 888-485-7736. That's 888-485-7736. And for more information, visit thermographycenters.com.
The Roselle Center for Healing is a proud supporter of breast cancer awareness and reminds you to conduct a monthly breast self-examination and include a thermographic breast scan as part of your annual wellness checkup.
Suffering from chronic health problems? Tired of taking dangerous drugs? This is Dr. Tom Roselle, host of Dr. Tom Roselle Live. Join me on Saturday, October 20th for my Ageless Health Seminar, How to Live Well and Prosper in a Stressful World. And I'll show you how to increase the quality of your health and length of your life. Saturday, October the 20th at the Fairview Park Marriott Hotel, Falls Church, Virginia. Seating is going fast. Don't be left out. Register today at rosellecare.com or by calling 703-698-7117.